Vision is the dominant sense for most of the people inside the organ of the sight is the I think of it likely irregular hollow sphere that takes in light and translate into images. If we enlarge the eyes and look inside, if we can discover that how it's done, inside the eyes are vitreous structure working together to create image brain can understand. Among these are the cornea, a clear dome-like structure covering iris or colored part of the eye, the lens directly below it, and the retina, which aligns the back of the eye. The retina consists of thin layers of light-sensitive tissues. This candle can help us understand how the eye captures images and then sends them into the brain. First, the light candle passes through the cornea as it does its bend or refract onto the lens. As the light passes through the lens, it bends a second time. Finally, it arrives at the retina where an image is formed. This doubled bending through the lenses reversed the image and turned it upside down. If that was the end of the story, the world would always appear upside down. But fortunately, the image is turned right up in the brain. Before that can happen, the image need to travel as impulse along the optic nerve and enter the brain occipital lobe. When the image forms, it regains its proper perspective of how. Let's consider two common conditions that cause blurry vision. The eye shape is important for keeping things in focus with normal vision light focus precisely on the retina at the location at the focal point. But the happen if light is longer, the eye is longer, then the longer the more distance there is the between lens and retina. But the cornea and lens is still bend light and same way that means the focal point will be somewhere in the front of the retina rather than on it. This makes it difficult to see that there are far away a person with a long eye said be nearsightedness glasses with concave lenses that can correct nearsightedness or also called as myopia and light coming through the cornea can push focal point back onto the retina. Far tightness just opposite the eye length is too short. When that happen, the focal point is behind the retina, so it's difficult to think that up close glasses with convex lens narrow the plane of the light. Narrowing the light passing through the cornea move the focal point back onto the retina. We can correct the far-sighted